Science. 16. The science of medicine. The science of medicine, advancements in health and disease. 1. Pharmacology. The study of drugs, their properties, and their effects on the body, is instrumental in developing effective treatments. Pharmacologists investigate how drugs interact with biological systems, including their absorption, distribution, metabolism, and elimination. They study the mechanisms of drug action at the molecular level and evaluate their therapeutic potential and safety profiles. Pharmacology plays a critical role in the development of new drugs, from initial drug discovery and preclinical testing to clinical trials and post-marketing surveillance. It also involves optimizing drug dosages, understanding drug-drug interactions, and studying the adverse effects of medications. The field of pharmacology is constantly evolving, incorporating advances in drug delivery systems, personalized medicine, and pharmacogenomics to improve patient care and outcomes. 2. Medical imaging. Techniques like X-rays, MRIs, and ultrasounds enable non-invasive visualization of the body's structures and functions, revolutionizing the diagnosis and monitoring of diseases. Medical imaging technologies provide valuable information about anatomical abnormalities, physiological processes, and the progression of diseases. X-rays use ionizing radiation to generate images of bones and tissues, helping detect fractures, tumors, and lung diseases. Magnetic resonance imaging, MRI, utilizes powerful magnets and radio waves to create detailed images of soft tissues, organs, and the central nervous system. Ultrasound imaging uses high-frequency sound waves to produce real-time images of organs, blood flow, and fetal development. Advanced imaging techniques like positron emission tomography, PET, and single-photon emission computed tomography, SPECT, provide functional information and help in diagnosing cancer, neurological disorders, and cardiovascular diseases. Medical imaging continues to advance, with developments in 3D imaging, molecular imaging, and hybrid imaging modalities. 3. Gene therapy. Gene therapy is a promising field aiming to treat diseases at the genetic level by replacing, inactivating, or introducing genes into cells. The goal is to correct genetic defects that cause diseases or enhance the body's ability to fight against diseases. Gene therapy approaches include using viral vectors to deliver therapeutic genes into target cells, modifying a patient's own cells ex vivo and reinfusing them, or directly editing the genome using gene editing technologies like CRISPR-Cas9. Gene therapy has shown potential in treating genetic disorders, such as certain types of inherited blindness and immune deficiencies. It is also being explored as a strategy for treating cancer, cardiovascular diseases, and neurological disorders. However, gene therapy still faces challenges related to safety, efficient delivery, and long-term effectiveness. Ongoing research and clinical trials are working to overcome these challenges and pave the way for more widespread and effective gene-based treatments. 4. Immunotherapy. Immunotherapy harnesses the body's immune system to fight diseases, particularly effective in treating certain types of cancer. It involves stimulating or enhancing the immune response to target and eliminate cancer cells or other disease-causing agents. Immunotherapies include monoclonal antibodies, immune checkpoint inhibitors, adoptive cell transfer, and cancer vaccines. These approaches can activate the immune system, boost immune responses, or modify the tumor microenvironment to enhance immune recognition and attack. Immunotherapy has shown remarkable success in treating various cancers, including melanoma, lung cancer, and certain types of leukemia. It offers the potential for long-term remission and improved survival rates compared to traditional treatments. However, challenges remain in understanding and overcoming resistance mechanisms, managing immune-related adverse effects, and expanding the application of immunotherapy to other diseases beyond cancer. 5. Regenerative medicine. Regenerative medicine is a field focused on repairing or replacing damaged tissues or organs, using strategies such as stem cell therapy and tissue engineering. It aims to restore the structure and function of damaged or diseased tissues, promoting the body's natural healing processes. Stem cell therapy involves the use of stem cells, either derived from the patient's own body or from other sources, to regenerate damaged tissues. Tissue engineering combines cells, biomaterials, and biochemical factors to create functional tissue constructs that can be implanted into the body. Regenerative medicine holds great potential for treating conditions such as heart disease, neurodegenerative disorders, spinal cord injuries, and organ failure. However, significant scientific and technological challenges need to be addressed, including improving the efficiency and safety of stem cell therapies, enhancing tissue vascularization, and ensuring long-term tissue functionality. 6. Preventive medicine. Preventive medicine focuses on strategies aimed at preventing diseases before they occur, through measures such as vaccination, lifestyle advice, and population-wide interventions. It emphasizes disease prevention and health promotion through a combination of individual and community-based approaches. Preventive medicine involves identifying risk factors, promoting healthy behaviors, and implementing interventions to reduce the incidence of diseases and improve overall health. This includes immunization programs, screenings for early detection of diseases, counseling on healthy lifestyle habits, such as diet, exercise, and smoking cessation, and public health policies addressing environmental and social determinants of health. By emphasizing prevention, preventive medicine aims to reduce the burden of disease, improve quality of life, and enhance population health outcomes. 7. Epidemiology. Epidemiology is the study of disease distribution and determinants in populations, crucial for public health decision-making. Epidemiologists investigate patterns of diseases, their causes, and their impacts on populations. They analyze data, conduct studies, and apply statistical methods to understand disease occurrence, risk factors, and disease outcomes. Epidemiology plays a vital role in disease surveillance, outbreak investigation, and the development of evidence-based interventions and policies. It helps identify populations at risk, evaluate the effectiveness of interventions, and assess the impact of public health programs. Epidemiological research informs public health strategies for disease prevention and control, including measures such as vaccination campaigns, health education programs, and targeted interventions to reduce health disparities. 8. Personalized medicine. Personalized medicine is an approach that tailors medical treatment to individual patients based on their genetic makeup, lifestyle, and environment. It recognizes that each person's disease risk, response to medications, and overall health are influenced by unique factors. Personalized medicine utilizes advancements in genomics, proteomics, and other omics technologies to characterize an individual's molecular profile and identify specific markers or biomarkers associated with diseases or treatment response. This information allows healthcare professionals to make more precise diagnoses, select optimal treatment strategies, and optimize medication dosages. Personalized medicine holds great promise in improving patient outcomes, reducing adverse drug reactions, and maximizing the efficiency of healthcare resources. It also paves the way for targeted therapies, early detection of diseases, and preventive interventions tailored to an individual's specific needs. 9. Antibiotic resistance. Antibiotic resistance is a global health challenge arising from the misuse and overuse of antibiotics, leading to the development of bacteria that are resistant to these drugs. Antibiotic resistance occurs when bacteria evolve mechanisms to evade the effects of antibiotics, rendering them ineffective in treating bacterial infections. This phenomenon poses a significant threat to public health, as it limits treatment options and increases the risk of infections becoming untreatable. Addressing antibiotic resistance requires a multifaceted approach, including appropriate antibiotic prescribing practices, improved infection prevention and control measures, public education on responsible antibiotic use, and the development of new antibiotics or alternative therapies. It also highlights the importance of antimicrobial stewardship programs to promote the judicious use of antibiotics and prevent the spread of resistant bacteria. 10. Mental health. Mental health is a field gaining recognition, addressing conditions such as depression, anxiety, schizophrenia, and promoting mental well-being. It focuses on understanding the complex interplay between biological, psychological, and social factors that contribute to mental disorders. Mental health professionals utilize a range of approaches, including psychotherapy, medication management, and psychosocial interventions, to assess, diagnose, and treat mental health conditions. They also emphasize preventive measures, early intervention, and promoting mental wellness through education, awareness campaigns, and destigmatization efforts. Mental health care aims to improve the quality of life for individuals with mental illnesses, support their recovery, and enhance overall mental well-being in communities. 11. Surgical innovations. Surgical innovations encompass advances in surgical techniques, technologies, and approaches that enhance patient outcomes, minimize invasiveness, and improve surgical precision. Minimally invasive surgery, such as laparoscopy or robotic-assisted surgery, utilizes smaller incisions and specialized tools, resulting in reduced pain, shorter hospital stays, and faster recovery times compared to traditional open surgery. Three-dimensional, 3D printing technology enables the creation of patient-specific surgical models, implants, and instruments, enhancing surgical planning and precision. Surgical innovations also include the development of novel surgical tools, imaging guidance systems, and intraoperative monitoring techniques. These advancements contribute to safer, more effective surgical procedures, improved patient comfort, and better long-term outcomes. 12. Nanomedicine. Nanomedicine is the application of nanotechnology in medicine, opening up new possibilities in drug delivery, imaging, diagnosis, and therapeutics. Nanoparticles, with sizes ranging from 1 to 100 nanometers, can be engineered to carry drugs, target specific cells or tissues, and release therapeutic agents in a controlled manner. This targeted drug delivery approach improves drug efficacy, reduces side effects, and enhances patient compliance. Nanomedicine also enables sensitive imaging techniques, such as nanoparticle-based contrast agents for improved detection and monitoring of diseases. Additionally, nanotechnology plays a crucial role in diagnostic platforms, biosensors, and lab-on-a-chip devices, enabling rapid and accurate detection of biomarkers for various diseases. Ongoing research in nanomedicine holds promise for personalized treatments, regenerative medicine, and the development of innovative therapeutics. 13. Telemedicine. Telemedicine is the practice of remotely diagnosing and treating patients through telecommunication technology, improving accessibility to healthcare. It utilizes video conferencing, remote monitoring devices, and secure electronic platforms to facilitate virtual consultations and medical services. Telemedicine allows healthcare providers to evaluate patients, provide medical advice, prescribe medications, and monitor chronic conditions without the need for in-person visits. It is particularly beneficial for individuals in remote or underserved areas, those with limited mobility, and those requiring regular follow-up care. Telemedicine also enables timely access to specialists, reduces healthcare costs, and minimizes travel burdens. The COVID-19 pandemic has further highlighted the importance and expanded the adoption of telemedicine as an effective means of healthcare delivery. 14. Neuroprosthetics. Neuroprosthetics involves the development and utilization of devices that substitute or improve the function of a part of the nervous system, enabling better treatment for neurological disorders. Neuroprosthetic devices interface with the nervous system to restore or enhance sensory, motor, or cognitive functions. Examples include cochlear implants for hearing restoration, retinal implants for vision restoration, deep brain stimulation for Parkinson's disease, and brain-computer interfaces for controlling prosthetic limbs or aiding paralyzed individuals. Neuroprosthetics combines neuroscience, engineering, and computer science to advance our understanding of neural circuits and develop innovative technologies that improve the quality of life for individuals with neurological conditions. 15. Artificial intelligence in medicine. The use of artificial intelligence, AI, and machine learning in medicine aims to improve diagnosis, treatment plans, and predict patient outcomes. AI algorithms analyze large volumes of medical data, including electronic health records, medical images, and genomic information, to identify patterns, make predictions, and assist in clinical decision-making. AI can help radiologists interpret medical images, aid in early detection of diseases, optimize treatment plans, and enhance patient risk stratification. Machine learning algorithms also play a role in drug discovery, predicting drug responses, and identifying potential adverse drug reactions. Integrating AI into healthcare systems holds promise for improving accuracy, efficiency, and personalized care, but ethical considerations, data privacy, and algorithm transparency remain important areas of discussion. 16. Clinical trials. Clinical trials are the process of testing new treatments, from drugs to devices, in human subjects to ascertain their safety and effectiveness. These studies follow strict protocols and are designed to generate reliable scientific evidence to support the approval and use of new interventions. Clinical trials involve different phases, including preclinical testing, phases I to III trials, and post-marketing surveillance. They adhere to ethical guidelines and informed consent procedures to protect the rights and well-being of study participants. Clinical trials are essential for advancing medical knowledge, improving patient care, and ensuring that new treatments are safe and effective before they reach the market. 17. Transplantation medicine. Transplantation medicine is the science of replacing an organ or tissue that is failing with a healthy donor organ or tissue. It encompasses organ transplantation, such as heart, liver, kidney, and lung, as well as tissue transplantation, such as bone marrow, cornea, and skin. Transplantation medicine involves complex procedures, including donor-recipient matching, immunosuppression to prevent organ rejection, and post-transplant care. It requires multidisciplinary teams of surgeons, immunologists, pathologists, and other healthcare professionals. Transplantation medicine has transformed the lives of countless individuals by providing a means to replace vital organs or tissues, but challenges remain, including organ shortage, rejection, and the long-term management of immunosuppressive medications. 18. Vaccine development. Vaccine development is the science behind creating vaccines, which stimulate immunity against infectious diseases and play a vital role in global health. The process involves identifying suitable antigens, conducting preclinical studies, and progressing through clinical trials to evaluate safety, efficacy, and optimal dosages. Vaccines can be based on attenuated or inactivated pathogens, subunit antigens, or genetic material. They stimulate the immune system to produce an immune response, including the production of antibodies and memory cells. Vaccination programs have been highly successful in preventing diseases such as measles, polio, and hepatitis. Ongoing research focuses on developing new vaccines, improving vaccine delivery systems, and addressing vaccine hesitancy to ensure widespread vaccination coverage and control the spread of infectious diseases. 19. Pediatric medicine. Pediatric medicine is the branch of medicine dedicated to the health and medical care of infants, children, and adolescents. It involves specialized knowledge and skills to address the unique healthcare needs of young patients. Pediatricians diagnose and treat a wide range of conditions, from common childhood illnesses to chronic diseases and developmental disorders. They monitor growth and development, provide immunizations, offer guidance on nutrition and preventive care, and manage acute and chronic illnesses in pediatric patients. Pediatric medicine emphasizes family-centered care, early intervention, and promoting healthy lifestyles to optimize the well-being and long-term health of children. 20. Geriatric medicine. Geriatric medicine is the specialization in healthcare for older adults, addressing the complex needs of an aging population. It focuses on promoting healthy aging, managing chronic diseases, and enhancing quality of life in older individuals. Geriatricians assess and manage age-related conditions, such as dementia, cardiovascular disease, osteoporosis, and mobility issues. They pay attention to the unique physiological, psychological, and social aspects of aging, including medication management, falls prevention, cognitive health, and end-of-life care. Geriatric medicine aims to optimize functional independence, promote healthy aging, and provide comprehensive and compassionate care for older adults. 21. Public health. Public health is the broader discipline focused on improving health at the population level, through disease prevention, health promotion, and health policy. Public health professionals address various determinants of health, including social, environmental, and behavioral factors. They work to prevent diseases and injuries, promote healthy lifestyles, and improve the overall well-being of communities. Public health encompasses areas such as epidemiology, biostatistics, health education, environmental health, and health policy. Public health initiatives include disease surveillance, health education campaigns, immunization programs, community interventions, and policy advocacy. By addressing population health needs and implementing evidence-based strategies, public health efforts have significant impacts on reducing health disparities and improving health outcomes for communities. Thanks for watching. Please like, share and subscribe, and comment below if you agree, or would like to add your thoughts.